February 19th, 1994. Riverside General Hospital, Riverside, California. Gloria Ramirez, a 31-year-old woman, was brought to the emergency room after she experienced severe symptoms that included breathing difficulty and confusion. She had been battling advanced cervical cancer for months and was receiving treatments to manage her pain and symptoms. Her condition had rapidly worsened, leading to her being rushed to the hospital. Symptoms. Upon arrival, Gloria was experiencing respiratory failure, a common complication of late-stage cancer. Her blood pressure was low, her pulse was weak, and she appeared disoriented. She was agitated and was struggling to breathe, making it clear that her condition was dire. Treatment protocol. The medical staff attempted to stabilize her by administering oxygen and various drugs. She was immediately placed on a ventilator to help her breathe, and her condition seemed to worsen over time. What the doctors didn't know was that her case was about to turn into something far more inexplicable. As the medical staff began to work on Gloria, something incredibly strange started happening. Unusual smell. The first abnormality was the smell that permeated the room. Several of the staff members described it as a strange, almost chemical odor. Some said it resembled garlic, while others described it as fruity or ammonia-like. The odor was overwhelming and unlike anything they had encountered before in a hospital setting. It was so pungent that it made some of the medical team feel nauseous, while others experienced dizziness and lightheadedness. Oily skin. The next oddity was that Gloria's body appeared to be covered in a thin, oily sheen. This was an unusual and unsettling detail. The sheen made her skin appear almost waxy, something that wasn't typical for a person in such critical condition. This physical change in her appearance was puzzling to the doctors, as they had not encountered anything like it in their medical careers. Vapor emission. As doctors and nurses began inserting an IV line to draw blood and administer medication, they noticed a faint vapor emanating from her body. It wasn't immediately clear what the vapor was, but it was clearly visible in the air. Some medical staff described it as mist-like or hazy. As the treatment continued, the hospital staff began to feel the effects of the strange, toxic environment. Symptoms of toxic exposure. Several doctors and nurses who were working in close proximity to Gloria suddenly began feeling unwell. Some of the medical professionals began to show symptoms such as dizziness, headaches, nausea, and difficulty breathing. Within minutes, some of them collapsed, while others fled the room in a panic. There was a sense of chaos as the medical team realized that whatever was happening to Gloria was also affecting them. Initial concern. The staff didn't know if the symptoms were a result of a contagious disease, a hazardous chemical reaction, or some kind of environmental hazard. No one knew what was happening, and the hospital staff was now equally concerned for their safety. The staff members who had been near Gloria were immediately taken away from the room and given medical care, but the situation was far from clear. Medical panic. One of the doctors in the room, Dr. Allen, was in charge of the care for Gloria. After a few moments of feeling dizzy, he lost consciousness and had to be removed from the room. A nurse working with him started feeling symptoms as well, including disorientation and nausea. Both were treated immediately, and other staff members were put on alert. Despite all the frantic medical attention, Gloria Ramirez's condition deteriorated rapidly. The final moments. Gloria passed away around 8:50 p.m., about 45 minutes after she was admitted to the emergency room. The exact cause of death was officially recorded as renal failure due to her advanced cervical cancer. However, there was nothing normal about the events surrounding her death. The medical staff and investigators were left with far more questions than answers. Investigation begins. Upon Gloria's death, hospital staff and the toxicology team began to investigate the strange events surrounding her condition. It became clear that something beyond standard medical causes had played a role in the reactions of the medical team and the unusual nature of her death. After Gloria's death, an autopsy was performed to determine the cause of death and investigate the possible presence of any toxic substances. Autopsy findings. During the autopsy, Gloria's body was found to contain unusually high levels of dimethylsulfone, DMSO2, a substance that is metabolized into dimethyl sulfoxide, DMSO. DMSO is used as a solvent in various medical treatments, especially for pain relief. However, it was never expected to be present in such high quantities in a patient who had not been treated with this substance directly. The chemical reaction. The toxicology experts speculated that Gloria had likely been self-medicating with DMSO or DMSO2 to alleviate her cancer-related pain. When these compounds interacted with the oxygen and other medical treatments used in the hospital, it likely produced a vapor that was toxic to those in close proximity. The role of DMSO. DMSO is known to have a peculiar property in which it can carry other substances through the skin and into the bloodstream. This means that if Gloria had used DMSO on her skin, it could have allowed other chemicals or drugs she had been exposed to, including toxic byproducts, to be absorbed and spread rapidly through her body. This could explain the mysterious symptoms and the vapor that appeared to emanate from her body. Once the hospital realized the strange nature of the event, the media quickly picked up on it. The case became a sensation, not only because of the tragic death of Gloria Ramirez, but because of the bizarre nature of the incident. Media coverage. News outlets across the country began to report on the toxic woman incident. The story of the medical staff being affected by a chemical vapor spread quickly, and the mysterious circumstances surrounding Gloria's death became a subject of fascination for the public. The strange and unexplained nature of the case invited numerous theories and speculations, with some even suggesting that Gloria had been poisoned or that she was carrying an unknown contagious disease. Public anxiety. People in the community, especially healthcare workers, became concerned that a dangerous new disease or chemical hazard was at play. The incident led to widespread fear, and Riverside General Hospital saw a temporary dip in the number of patients as people began to avoid the facility. Various theories emerged in an attempt to explain what had occurred. These ranged from scientific explanations to more fantastical ideas. Here are a few that emerged. DMSO and dimethyl sulfone theory. The prevailing theory among medical experts was that Gloria's use of DMSO for pain relief contributed to the toxic vapor. DMSO, when metabolized in her body, broke down into dimethyl sulfone, which, when combined with the hospital's oxygen supply, produced dimethyl sulfoxide, DMSO. This created a toxic vapor, which affected those who inhaled it. This theory remains the most widely accepted explanation for the incident. Sarin gas theory. Some speculated that the vapors were a form of sarin gas, a potent chemical warfare agent. However, tests for sarin were negative, ruling out this possibility. Experts pointed out that sarin could not have formed spontaneously in the environment of the hospital. Fungal infection theory. Another theory was that Gloria had contracted a rare fungal infection that released toxins into her body. However, this idea was also largely dismissed, as there was no clear evidence to support it. After Gloria's death, the medical community and authorities were left with a range of unanswered questions. Health impact on medical staff. A few medical staff members who were exposed to the vapors continued to report lingering symptoms like headaches, dizziness, and difficulty breathing. Some even went on to seek treatment for their symptoms. However, most recovered over time, and no long-term health effects were confirmed. Further investigations. Investigators continued to look into the case, but no clear-cut answers were ever found. Some believed that it was a case of accidental chemical exposure, while others were still perplexed by the nature of the incident. Hospital reforms. Following the incident, Riverside General Hospital underwent a series of reviews regarding its safety protocols. Hospital staff received new training about chemical safety and exposure. The case also prompted discussions about the use of DMSO in medical treatments, particularly its potential side effects. The toxic woman case left a lasting legacy in both medical and popular culture. Ongoing mystery. To this day, the exact cause of the toxic reaction remains unclear. Theories persist, but the event continues to fascinate people interested in medical mysteries. It also serves as a reminder of how much we still don't understand about certain chemical reactions, especially those that occur within the human body. Cultural impact. The story of Gloria Ramirez has been featured in books, documentaries, and even in popular media as a strange and unexplained medical event. The toxic woman moniker stuck, and it became one of the most famous cases of chemical exposure in medical history. Thanks for watching. If you enjoyed this video, hit that like button, subscribe, and ring the bell for more. Let me know your thoughts in the comments. I'd love to hear from you. See you in the next one. Bye for now.